Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 041. A woman complains of frequent watery stool, up to 9 to 10 times per day, with mucus and blood. Admixtures, dull pain in the hypogastrium, weight loss of 4 kilograms within the last year. Objectively, malnutrition, dry skin, low turgor, aphthous stomatitis. The abdomen is soft, the sigmoid colon is spastic and painful on palpation. Occult blood test is positive. Fibrocolonoscopy, edema, hyperemia, mucosal granulation, pseudopolyps, small ulcers with irregular edges. Make the diagnosis. A. Irritable bowel syndrome. B. Crohn's disease, regional enteritis. C. Nonspecific, ulcerative colitis. D. Colon cancer. E. Chronic enterocolitis. Disorders of the digestive system, esophagus, stomach, and intestines, irritable bowel syndrome. IBS, a functional gastrointestinal disorder, which means there is some type of chronic disturbance in bowel function. It can cause a great deal of discomfort and can severely affect the quality of life. The symptoms can range from mildly annoying to disabling, which negatively impacts a person's self-image, their social life, and the ability to work or travel. The patients are more likely to have other functional disorders such as fibromyalgia, chronic fatigue syndrome, chronic pelvic, or temporomandibular joint, TMJ, disorder. Inflammatory bowel disease, IBD, inflammation or chronic swelling of the intestines. Gastroesophageal reflux disease, GERD, stomach acid frequently flows back into the esophagus. The acid reflux can irritate the lining of the digestive system. Celiac disease, an immune system disorder, triggered by the consumption of foods that contain gluten, a protein, found in wheat, barley, and rye. Over time, it can cause great damage on the small intestine, causing digestive problems and nutrient deficiencies from a lack of proper nutrient absorption. Enterocolitis, an inflammation of the digestive tract, involving enteritis of the small intestine and colitis of the colon. It may be caused by various infections, with bacteria, viruses, fungi, parasites, or other causes. Colon cancer, a cancer that begins in the large intestine, colon. It typically affects older adults, though it can happen at any age. It usually begins as small, non-cancerous, benign polyps that form on the inside of the colon. Over time, some of these polyps can become colon cancers. Diverticular disease, small bulges or pockets, diverticula, develop in the lining of the large intestine, colon. Diverticulitis, a condition where the diverticula become inflamed or infected. Inflammatory bowel disease, IBD, ulcerative colitis, UC, an immune system disorder. The colonic mucosa proximal from the rectum is persistently affected, frequently involving erosions and/or painful ulcers, as well as involving repeated cycles of relapse and remission and potential extraintestinal manifestations, anemia, mouth sores, uveitis, arthritis, osteoporosis, skin conditions, liver conditions, and cancer. Crohn disease, CD, an inflammatory bowel disease which causes inflammation of the digestive tract. It can involve various sections of the digestive tract, which often spread into deeper layers of the bowel. It can be extremely painful and debilitating and sometimes lead to life-threatening complications. The answer is C. Nonspecific ulcerative colitis.